Hi everyone, welcome back to my YouTube channel, and today we are going to talk about ethmoid bone. And here at the side you can see a diagrammatic representation of ethmoid bone showing different parts of ethmoid bone. So let's start our topic with introduction. Ethmoid bone is small yet remarkably complex bone located at midline of skull. Despite its size, it plays a critical role in forming the craniofacial framework while contributing to the nasal cavity structure and the orbits. Known for its intricate internal architecture, the ethmoid bone is essential for both respiratory function and the sense of smell. Now let's talk about structures. Ethmoid bone is single unpaired bone that occupy a central location at the anterior cranial base. It is characterized by delicate sponge-like internal structure which is filled with air cells. The ethmoid air cells that are part of paranasal sinus system help reduce the overall weight of skull and contribute to the resonance of voice. Now let's talk about key components of ethmoid bone. The first is cribriform plate, as you can see here in the diagram. The perpendicular plate, ethmoid labyrinth, and orbital plates. Here you can see all of these parts in the diagram. The first we will talk about cribriform plate. Cribriform plate is a horizontal perforated component of ethmoid bone that forms the roof of nasal cavity. Numerous small foramina allow the passage of olfactory nerve fibers from the nasal mucosa to the olfactory bulb in brain, thereby facilitating sense of smell. Next component is perpendicular plate. That extends vertically downward. The perpendicular plate forms a major portion of nasal septum. It divides the nasal cavity into two separate chambers, playing a crucial role in supporting nasal airflow and proper functioning of respiratory system. Next component is ethmoidal labyrinth. That is flanking the cribriform plate laterally. The ethmoidal labyrinth consists of multiple small air cells that are also called lateral masses. These labyrinthine structures vary in number and size, help flatten the skull, and involve in humidification and warming of inhaled air. Next key component is orbital subplates that on each side portion of ethmoid bone contribute to forming the medial wall of orbit. These thin plates not only serve as a protective barrier for the eye but also impact the passage of structures such as nerve and blood vessels. Now let's talk about developmental aspects of ethmoid bone. First we will talk about embryological origin. Ethmoid bone is one of the first bone to ossify in the fetal skull. It originates from cartilaginous precursor and undergo complex ossification processes that involve the fusion of multiple centers. The early developmental highlight its importance in establishing a critical framework of the face and cranial base. Disturbances in its development can lead to malformation affecting the nasal cavity and overall midfacial structures. Further talking about development and aspects of ethmoid bone, we will talk about growth and maturation of the ethmoid bone. During childhood and adolescence, the ethmoid bone continues to develop and remodel, adapting to the growth of surrounding orofacial structure. This dynamic process contributes to the final positioning of the nasal cavity, orbits, and adjacent skull base area. As the bone matures, the air cells within the ethmoidal labyrinth enlarge and contribute to the functionality of paranasal sinus system. Now let's talk about functional significance of ethmoid bone. The first is olfactory function. As the forefront of the ethmoid bone function is involvement in infection. This perforation in cribriform plate allows olfactory nerve fiber to transmit scent information from the nasal cavity to the brain. This pathway is integral not only for perception of smell but also for triggering taste sensation and influencing behavior and memory. Further talking about its functional significance, it has structural support as ethmoid bone contributes significantly to support and integrity of the midface. By forming part of nasal septum and wall of orbit, it provides essential protection for the eye and maintain the shape of nasal passage. Its lattice-like structure also plays a key role in stimulating and dispersing forces which help prevent injuries from impacting the delicate structure of the facial bones. Further talking about functional significance, it also contributes to the sinus physiology, as ethmoid air cells are involved in resonation of the voice and in regulation of air humidity and temperature. By being part of larger personal paranasal sinus system, the ethmoid bone assists in creating a balanced environment for respiratory activities. This function is critical in maintaining the health of the nasal mucosa and tightly connected structures. Now let's talk about clinical significance of ethmoid bone. The first is sinusitis and infection. Due to its incorporation in paranasal sinus system, the ethmoid bone is susceptible to inflammatory conditions such as ethmoid sinusitis. Infection or inflammatory process in these air cells may lead to pain, congestion, and even spread of infection to adjacent structures. In severe cases, complication can include orbital cellulitis due to its thin barrier between the ethmoid cells and the orbit. Next, we talk about clinical significance. There is traumatic injuries that the delicate cicatriform plate due to its numerous perforation can be vulnerable to fracture in case of head trauma. Such fracture risks compromising the olfactory nerve, leading to a diminished or lost sense of smell, and may also raise the potential for CSF leakage if the integrity of the cranial base is breached. Further talking about clinical significance, there may be surgical implications that are important in the anatomy of ethmoid bone, and it is because of its proximity to critical neurovascular structures. Any surgical intervention near the ethmoid bone requires precision. Functional endoscopic sinus surgery that often targets ethmoidal sinus to restore normal drainage and alleviate chronic sinusitis. Surgeon must carefully navigate the labyrinthine structures to avoid damaging the olfactory fibers and adjacent olfactory fibers. Now let's talk about conclusion of this lecture video. Ethmoid bone exemplify how a small structure can have a profound impact on both form and function in craniofacial region. Its sophisticated anatomy encompassing the cribriform plate, perpendicular plate, ethmoidal labyrinth, and orbital plate underlie its essential role in infection, structural support, and sinus physiology. A thorough understanding of this bone is critical for both anatomical study and clinical practice, particularly in fields such as otolaryngology, neurosurgery, and facial reconstructive surgery. And this was all about ethmoid bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.